What causes brown spotting before my period? You look at your underwear and notice some small brown spots. It's not time for your period yet. What's going on here? It's likely spotting, which refers to very light bleeding that happens outside of your usual menstrual cycle. It's not enough to fill a pad or a tampon, but it's often visible on toilet paper or underwear. Spotting can range in color from light pink to dark brown. Brown spotting gets its color from old blood, which can start making its way out of your body 1 to 2 weeks before the start of your period. For some, this is just a normal part of their cycle. For others, it may be a symptom of an underlying health condition. Here's a look at the potential causes of brown spotting and other symptoms to watch for. Menstruation. Brown spotting is often just sign of ovulation or your actual period starting. This is totally normal and nothing to be concerned about. Ovulation. If you have brown spotting that starts a good 2 weeks before your period, it could be a sign of ovulation-related hormonal changes. Typically, you ovulate about 10 to 16 days after the first day of your last period. This is when your ovaries release an egg for fertilization. Ovulation occurs when your estrogen levels are high. These drop after the egg is released. This decrease in estrogen can cause some bleeding and spotting. But if you take birth control pills, your brown spotting may be a sign of something else. Typically, birth control pills prevent ovulation. Your period. Sometimes, brown spotting is just a precursor to your period. The brown blood or discharge may be the remnants of old blood that was never fully shed from your uterus the last time you had your period. This usually isn't cause for concern. But if you're regularly having very short cycles that last for only 2 weeks or so, it's best to follow up with your healthcare provider. Birth control. If you use hormonal birth control, brown spotting may be a sign of breakthrough bleeding. This is bleeding that occurs between periods as your body adjusts to the hormones from your birth control. You will likely experience some spotting and breakthrough bleeding in the first 3 to 6 months after starting a new method of hormonal birth control. It's especially common if you are taking a birth control pill that doesn't have estrogen. Pregnancy. Sometimes, brown spotting before your period is actually implantation bleeding. This is mild bleeding or spotting that happens when a fertilized egg implants itself in your uterus. Keep in mind that only some pregnant people experience implantation bleeding. Perimenopause. Perimenopause refers to the period of time leading up to menopause. During this time, which can start up to 10 years before menopause, your hormones start to fluctuate. In response, you might not ovulate or menstruate as often as you once did. If you're in perimenopause, irregular periods and spotting between periods are often normal. You might have a long, heavy period followed by a relatively light, short period. But if you have very heavy bleeding or bleeding that occurs more often than every 3 weeks, follow up with your healthcare provider. Underlying health conditions. Sometimes, brown spotting between periods is a symptom of an underlying condition that needs treatment. Sexually transmitted infections. Sexually transmitted infections, STIs, can cause irritation in your vaginal tissues that can lead to bleeding and spotting. Additional symptoms you might experience related to an STI include pelvic pain, burning sensation when urinating, fever, nausea, pain during sex, unusual or foul-smelling discharge, such as green or yellow discharge. If you have symptoms of an STI, see a healthcare provider as soon as possible to avoid any complications or transferring the infection to others. Cervical cancer. Cervical cancer can cause vaginal bleeding between periods, even after menopause. Keep in mind that cervical cancer is simply a potential cause of brown spotting, not a likely one. In addition to brown spotting, you may also have unusual vaginal discharge. It can be foul-smelling, watery, or even blood-tinged. These are usually earlier symptoms of cervical cancer. Later symptoms include back pain, fatigue, pelvic pain, problems going to the bathroom, unexplained weight loss. Brown spotting can be a completely normal part of your cycle. But if it's accompanied by any unusual symptoms, especially a fever, unexplained fatigue, or pelvic pain, it's best to follow up with your healthcare provider.